This is Kristina and Roderick from one of the trainings last year or 2 years ago?
Last year.
Last year, okay.
Last summer.
Yeah, probably. So you're
Yes,
able
it
to
was
take
last.
and use EMDR with your clients
Yes.
in the training?
Yeah.
How is
Yep.
it?
It's a great tool to use whenever you recognize someone, even from the very start at intake, that you hear some undertones of trauma, that you already start thinking, okay, how can I use EMDR with this person?
Okay.
Yes. And I use it not only at the day practice that I work at, but my private practice, mostly with veterans. And I'm definitely finding that um, um, cognitive processing therapy and the other therapy, the exposure therapy, um, does work. But so far, I'm having some very good success with EMDR and veterans, especially those from the Vietnam era.
The old guys.
The older guys,
I'm a
yes.
Vietnam era veteran, actually. I was in Vietnam. So how do you do EMDR first and then the others if it doesn't work, or how do you decide which process to use?
Well, I do EMDR first now. Before I was trained in CPT and prolonged exposure therapy,
Okay.
but after I did my training with you, I felt a lot more confident that these gentlemen would accept that particular process a lot better. And so far, that has been true. I haven't had anyone yet that has, I guess, been so complex to where I felt like, okay, I need to switch to, either of the other two.
Oh, okay. So you're able to use EMDR with that.
Yes.
And then for you, Christina, you were able to take it and use it right away in your practice?
Mhm.
What are you doing?
Yeah, with some people who are real open and truly motivated to change, I'll kind of present it first with just a psychoeducational aspect of how the brain works with trauma, and um, I'm also trained as a emotionally focused couples therapist, so
Oh,
I
yeah.
tend to work a lot with emotions. So it really overlaps nicely in terms of um, using EMDR as a way to get people into their affective self.
So when you do EMDR with couples, do you ever do it with both in the same room, in the room at the same time? You don't.
No, I haven't. I haven't yet.
Okay. Well, you may not.
So yeah.
That's a question. Okay. So that may be good. So you guys recommend the training? I mean, you feel like it was helpful to your practice? And
Mhm.
Oh, absolutely. I recommend the training. Always looking for something uh, evidence-based that I can use, especially with the diverse population that we actually see. We have a pretty good, I would say we have a pretty diverse population here at Legacy where we work at, you know, and it's always good to have something that so far appears to be, showing some pretty good success. So the training that we got from you, I would definitely recommend it.
there you go.
Mhm.
All
Yeah.
right.
Yeah.
Okay. And you use it for more than just trauma, right? The EMDR.
Yeah.
Yes,
Okay.
yes.
Mhm.
Because that's one thing we
Trauma,
stress and talk about.
anxiety.
Depression.
Mhm.
Got it all.
Yeah. The other thing is I know here at Legacy, our psychiatrists have also really been on board with EMDR as well, which I think is a great thing that um, it's created a new way to be able to collaborate with them because it is evidence based. That it helps them also see more of the positive changes in the patients versus maybe people who would say, "Oh yeah, I'm eclectic," versus actually being able to use evidence based. And so the psychiatrists really appreciate that as well.
Were they on board from the start, or did they learn about the EMDR
Um,
from you guys?
some more than others.
I think the ones who had a little bit more information or some understanding of what EMDR was all about,
Okay.
they were definitely intrigued. And those that, of course, only had, I would say, basic understanding, they would say, oh, that's the thing with the fingers. And I'm like, oh, it's a lot more than that.
Okay. Well, and tell me this: are you guys using tappers or your hands, or what are you doing for bilateral stimulation?
I typically use the tappers, just because that was how I whenever we did the training, I got the most results for myself out of using the tappers. So I tend to start with that, and then with a few of my teens, I've done with headphones since they're glued to headphones anyways, and they responded well to that.
Okay.
Yeah, same here. Same here. It's I think when I came to Beaumont and had an opportunity to use the tappers for the first time, I recognized how much easier that was for me to be able to focus on the image. And if when I use with teens, it has been the headphones.
Okay. So you guys deal with veterans, teens, adults, the whole.
Mm.
Yeah, good. Okay. Well, thanks a lot. That's great. I enjoyed.
Thanks,
Good
All
Jordan.
seeing
right,
you
Jordan.
guys.
Hey, thanks a lot.
And,
All right, you take care. We'll talk soon.
see you in Niagara Falls.
Alrighty. Bye.